Imagine you're sitting at the breakfast table. Everything feels completely normal. You reach for your coffee, and suddenly, the cup slips from your hand. You try to pick it up, but your arm feels strangely heavy. Your spouse asks, "Are you okay?" You know exactly what you want to say, but the words coming out of your mouth sound confused and slurred. Then you notice something even more frightening.
One side of your face doesn't seem to be moving normally. What would you do? Would you wait a few minutes to see whether it passes? Would you lie down and hope you feel better? Would you call your son or daughter first? Or would you recognize what could be happening and immediately call emergency services? If you're over 60.
The next few minutes of this video could be some of the most important health information you learn this year. A suspected stroke is not something to watch and wait on. It is an emergency. And knowing exactly what to do and what not to do can prevent a dangerous delay in treatment. I'm Dr. Peter, and today we're talking about those frightening first minutes when a stroke may be happening.
I'm going to show you a simple 3-minute emergency response plan that you and your family can remember. Not a trick that magically stops a stroke. There is no safe home technique that can do that, but a sequence of actions that can help you recognize the emergency, avoid common mistakes, and get professional treatment as quickly as possible. Please stay with me until the end, because knowing only one part of this information isn't enough. We're going to cover the warning signs, what you should do immediately, what you should never give the person to eat or drink, why noting the time matters, and what to do even when symptoms suddenly disappear. Before we continue, tell me something. How old are you? And have you or someone in your family ever experienced a stroke or mini-stroke? Tell me in the comments. And tell me which country you're watching from. If you're watching from the USA and the hype button is available below this video, press it. If you're watching from another country, press the like button and tell us where you're joining us from.
It is incredible seeing seniors and families learning together from different parts of the world. Now, let's understand the problem. A stroke occurs when blood flow to part of the brain is interrupted, or when bleeding occurs in or around the brain. When brain tissue is deprived of normal blood and oxygen, cells can become injured. That is why you've probably heard doctors say, "Time is brain."
But here's where many people make a dangerous mistake. They expect a stroke to look dramatic. They imagine someone immediately collapsing unconscious onto the floor. That can happen, but many strokes don't begin that way. A person might still be sitting upright. They may still be awake. They may even insist that they're fine. The warning could be something as subtle as suddenly dropping a spoon.
Maybe their smile looks uneven. Maybe one arm unexpectedly becomes weak or numb. Maybe they know what they want to say, but their speech suddenly sounds strange. Perhaps they suddenly cannot see properly from one or both eyes. They may experience sudden trouble walking, dizziness, loss of coordination, or an unusually severe headache. These aren't symptoms to sleep off, and I want you to remember a simple word: fast. F stands for face. Ask the person to smile. Does one side of the face droop? It stands for arms. Ask them to raise both arms. Does one arm drift downward, or can they suddenly not lift it normally? S stands for speech. Ask them to repeat a simple sentence. Is their speech suddenly slurred, strange, or difficult to understand? And T stands for time.
If you see any of these signs, it's time to call emergency services immediately. You don't need all 3 symptoms. Even one sudden warning sign can be enough to justify urgent action. Now we come to the first part of your 3-minute response plan. Minute 1. Recognize it and make the call. Don't spend 10 minutes searching symptoms online. Don't drive around looking for a clinic. Don't wait for another family member to come over and give their opinion. Call your local emergency number immediately and say clearly, "I think this may be a stroke." Why use the word stroke? Because that information helps emergency dispatchers understand the urgency of the situation. And whenever possible, use emergency medical services rather than having someone drive the patient to the hospital themselves. Paramedics can begin evaluating the person on the way, communicate with the receiving hospital, and respond if the patient's condition suddenly deteriorates. Now here's another detail that is incredibly important. Look at the clock. Try to remember the exact time the symptoms began. If you didn't actually see them begin, note the last time the person was known to be normal. Why does that matter? Because some stroke treatments are highly time dependent. When the hospital team asks, "When did this start?" the answer can influence important treatment decisions, so don't assume you'll remember. Write the time down on your phone or a piece of paper. Now we move into minute 2. Keep the person safe. If the person is standing or walking when symptoms begin, help them get into a safe position so they don't fall. Do not encourage them to walk around to get the circulation moving. Don't make them exercise. Don't massage their arms or legs. And don't perform unproven pressure techniques. Your job isn't to treat the blocked or bleeding blood vessel yourself. Your job is to keep the person safe while professional help is coming. If they're conscious, keep them comfortable and follow the emergency dispatcher's instructions about positioning. If they become unconscious but are breathing, the dispatcher can guide you on what to do. If they aren't breathing normally, emergency dispatch can guide you through CPR if needed. And please remember something particularly important for seniors. Don't automatically give aspirin. Many people have heard that aspirin can help during a heart attack and assume they should give it whenever someone develops stroke-like symptoms. But not every stroke is caused by a clot. Some strokes involve bleeding in the brain. Because you cannot determine the stroke type at home, don't give aspirin for a suspected stroke unless a qualified medical professional or emergency dispatcher specifically instructs you to do so. The same applies to other medications. This is not the moment to experiment. Now we reach minute 3. Protect the person from another common danger. Don't give them food or drink, not even a big glass of water. This surprises people because their instinct is often, they look weak. Let me give them something. But a stroke can interfere with swallowing. Someone may appear awake, yet have difficulty safely swallowing liquids or food, creating a choking or aspiration risk. So resist the urge. Keep reassuring them. Stay nearby.
Watch their breathing and level of responsiveness. Have important information ready for paramedics if possible, including medications, allergies, medical conditions, and when the symptoms started.
Those 3 minutes
Aren't about performing a miracle, they're about avoiding delay.
recognize, call, note the time. Keep them safe. Give nothing by mouth unless instructed. Follow emergency guidance. Now let me ask you a question. Suppose your right arm becomes numb for 2 minutes, your speech becomes slightly slurred, and then suddenly everything returns to normal. Would you still call for help? Many people would say no, and that could be a serious mistake. Temporary stroke-like symptoms can occur with a transient ischemic attack, often called a tear or mini-stroke. The symptoms can disappear, but that doesn't mean the danger should be ignored. A tear can be an important warning that urgent medical assessment is needed. So if someone's face droops, an arm suddenly becomes weak, or speech becomes abnormal and then returns to normal, don't celebrate and go back to breakfast. Seek emergency medical evaluation. Think of it this way. If a smoke alarm suddenly starts screaming and then stops, you don't automatically assume there was never smoke. You investigate. Your brain deserves at least that much attention. There's another mistake I want older viewers to understand. Don't blame every sudden change on aging. Getting older can bring gradual changes. Perhaps you walk a little more slowly than you did at 30.
Maybe you need reading glasses. Maybe getting out of bed takes an extra moment. But sudden neurological changes are different. If someone is speaking normally and suddenly cannot form words, that isn't ordinary aging. If both arms are functioning normally and suddenly one becomes weak, that's different. If someone is sitting comfortably and suddenly develops severe balance trouble, that's different. The word I want you to remember is sudden. Now, why do seniors sometimes delay calling for help? Sometimes it's fear, sometimes it's denial, and sometimes it's independence. You might think, I don't want to bother my children, or I don't want an ambulance coming to my house, or maybe I'll feel better after I rest. But when stroke is possible, asking for help isn't weakness.
It's the appropriate response to a medical emergency. You can apologize for a false alarm later. You cannot recover minutes that were unnecessarily lost. This is also why I want families watching today to talk about this before an emergency occurs. Tonight, ask your spouse, parent, sibling, or adult child one simple question. If I suddenly show signs of a stroke, do you know what to do? Make sure everyone knows where medication information is kept. Know your local emergency number. Make sure your home address is easy to provide. Keep emergency contacts accessible. Preparation reduces confusion. Now, let's talk briefly about what happens after a stroke, because this is where hope matters. A stroke can affect movement, speech, memory, vision, balance, swallowing, and other abilities, depending on which part of the brain is affected and how severe the injury is. But the brain also has an extraordinary ability to adapt. You may hear healthcare professionals use the word neuroplasticity. In simple language, it means the brain can reorganize some of its connections. Rehabilitation can help people practice movement, speech, balance, and everyday skills again. But recovery isn't identical for everyone. Some people improve quickly. Others need months of rehabilitation. Some are left with lasting disabilities. That's another reason why rapid treatment matters so much. After the emergency phase, rehabilitation may involve physical therapy, occupational therapy, speech therapy, swallowing assessment, medication management,
and changes designed to reduce the risk of another stroke. And prevention deserves just as much attention as emergency response. One of the most important things you can do after 60 is know your numbers. What's your blood pressure? Do you know? High blood pressure is a major modifiable stroke risk factor, and it can exist without making you feel obviously sick.
Blood sugar matters too, particularly if you have diabetes. Cholesterol, smoking, physical inactivity, diet, heart conditions such as atrial fibrillation, and other medical factors can also influence stroke risk. The solution isn't some mysterious 3-minute morning ritual. It's consistent care. Take medications as prescribed. Don't stop blood pressure or heart medication because you feel fine without discussing it with your clinician. Stay physically active at a level appropriate for your abilities. Eat a balanced diet rich in vegetables, fruits, whole grains, and other nutritious foods. Avoid smoking. Keep medical appointments. And talk to your healthcare professional about your personal stroke risk. If you've already had a TIA or stroke, follow the prevention plan your healthcare team gives you. Now, I want to return to the scene we started with. You're sitting at breakfast. The cup falls. Your arm feels weak. Your words don't sound right. But this time, you aren't sitting there wondering what to do. Someone looks at your face. They ask you to raise both arms.
They hear the change in your speech. They call emergency services. They note the time. They keep you safe. They don't give you food, water, aspirin, or some internet remedy. And when the paramedics arrive, they can immediately begin doing what they're trained to do. That's what preparation looks like. Not panic, not a miracle trick. Recognition followed by fast professional care.
If you've watched this far, I want you to do something right now. Repeat these 4 letters in your mind. FAST, face, arms, speech, time. And then answer this question in the comments. Before watching today, did you know that stroke symptoms can sometimes disappear and still require urgent medical attention? Also tell me your age and which country you're watching from. If you're watching from the USA and the hype button is available, press hype so this information can reach more seniors. If you're watching from another country, press the like button and write your country below. I want to see how many different places our senior health community reaches. And please share this video with your spouse, parents, brothers, sisters, neighbors, or friends over 60. You may watch this video today and never personally need the information, but someone you share it with might. Before we finish, here's your emergency plan one final time. If stroke symptoms suddenly appear, recognize fast, call emergency services immediately, record when the symptoms began or when the person was last known well. Keep them safe. Don't give food or drink.
Don't give aspirin unless instructed by a medical professional, and follow the emergency dispatcher's directions until help arrives. Don't wait for the symptoms to become severe. Don't assume you're safe because they disappear. And don't waste precious minutes trying an unproven home technique.
When it comes to stroke, the most powerful 3-minute trick isn't a secret breathing pattern or pressure point. It's knowing what you're seeing and getting the right help without delay. If this video gave you information you want your family to know, subscribe to Dr. Peter's Health, turn on notifications, and press like. We make practical videos specifically for older adults about balance, falls, nerve health, mobility, nutrition, healthy aging, and the warning signs seniors shouldn't ignore. Take care of yourself, look after the people you love, and remember this: when the warning signs of stroke appear, don't wait to see what happens. Think fast, act fast, call for help. I'll see you in the next video.